Assalamualaikum, this is Eishal, Rasheed, the student of first year BDS at CMH Lahore Medical College and Institute of Dentistry, and I would like to argue that the largest hidden contributor to carbon dental footprint isn't what you think. It's not disposal, rather, repetition. Sustainability in dentistry is usually discussed in terms of materials, waste segregation, or eco friendly products. But in endodontics, every failed or retreated root canal multiplies environmental cost, clinical workload, and patient distress. Sustainability is now a clinical responsibility. Healthcare contribute approximately 4 to 5% of global greenhouse gas emissions. Dentistry as a part of healthcare plays a role through repeated clinical encounters. Dentistry as a part of healthcare plays a role through repeated clinical encounters. Dentistry as a part of healthcare plays a role through repeated clinical encounters. Dentistry, high material turnover, and energy consumption. This makes sustainability not just an environmental concern but a clinical responsibility that begins at the chairside. Canal treatment does not end at failure, it multiplies impact. Each failure leads to retreatment, additional radiographs, further instrumentation. Each failure leads to retreatment, additional radiographs, further instrument, repeated patient visits, increased material use, and often surgical intervention or extraction. In sustainability terms, failure acts as a carbon multiplier, not because dentistry is inherently unsustainable, but because imprecision increases repetition. Sustainability is defined only by materials, it remains incomplete. At the chair side, sustainability should be defined by one, maximizing treatment longevity while minimizing failure. Maximizing treatment longevity while minimizing failure. A treatment that lasts is way more sustainable than a treatment repeated twice, regardless of how eco friendly the materials may be. Framing shifts sustainability from policy to practice, from ideology to outcomes. Thus, I present the three pillars of precision driven sustainability model. First, diagnostic precision, choosing the right case, the right indication, and the right treatment. Technical precision, executing treatment according to evidence based protocols. Longevity focused thinking, planning not just for canal obturation but for long term tooth survival. Not every tooth that hurts needs a root canal. Pillar 1 focuses on precision based diagnosis, implemented through a standardized RCT diagnostic checklist. It ensures that every case is systematically evaluated before treatment begins. In addition, cases are graded based on difficulty, helping clinicians decide whether to proceed, refer, or modify the treatment plan. This directly reduces failed root canal treatments, making accurate diagnosis a preventive sustainability measure rather than just a clinical formality. Pillar 2. The second pillar emphasizes technical precision achieved through an outcome based endodontic audit system. It evaluates key technical parameters such as working length accuracy, quality of canal obturation, and post operative radiographic outcomes. By tracking retreatment rates and technical deviations, clinicians can continuously refine their techniques and protocols. This transforms technical precision from an individual skill to a system level quality control mechanism, reducing failure rates and the need for repeat procedures. Pillar 3. The third pillar extends beyond the root canal itself. A technically successful endodontic treatment can still fail without proper corneal restoration, occlusal planning, and a long term follow up plan. Integrating restorative planning into endodontic decision making ensures that teeth are not just treated, rather, preserved. Longevity transforms clinical success into sustainable success, both environmentally and psychologically. Precision is dentistry's most sustainable act. Sustainable dentistry does not begin with greener materials, rather, better decisions. Because true sustainability in dentistry begins with doing it right the first time. Thank you. Precision